Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to Doctors in the House for IBN's 20th anniversary. I am Dr. Nadia Swamad from Health Express Doctors Limited in Cunupia. I graduated as a doctor in 2015 at the University of the West Indies in Trinidad and Tobago, and I worked in the public hospital for a number of years in the accident and emergency department. Today I have with me my assistant, Reya, who is going to assist me with this segment by asking me some questions. My topic today is about preventative medicine, and we will use the example of diabetes in this session. Welcome, Reya.
Hi, thank you for having me. Today in this segment, we will be talking about preventative medicine. And yeah, so let's jump right in. So Dr. Nadia, prior to you having Health Express Doctors Limited, you also worked in accident and emergency. Could you tell us a little bit about your experience there?
Yes, sure. So I worked in a public hospital in accident and emergency for a number of years. And we usually see very sick patients at the accident and emergency department. So we will have patients who would come in having strokes, heart attacks, sometimes patients having kidney failure, very, very life-changing illnesses. And many times when you speak to the patient or the relative, when we're doing our interviews, I would realize that a lot of times these patients have certain things in common: high blood pressure, diabetes, high cholesterol. And also what they have in common is that a lot of times they didn't take their medication, they didn't understand the seriousness of the conditions that they had. And it seemed as though they didn't understand that by not using their medications and controlling the conditions that they have, they didn't understand clearly how severe it could become. And whilst I work in the emergency department, I wished in my heart that I could somehow meet these patients before they reach the hospital, even by a number of years, and sit with them and explain to them the nature of the illness that they have, come down to the nitty-gritty, let them understand in a lot of details what is happening to them and why they need to control it and how they can do so. So I'm really grateful for this opportunity to be able to do some educational content and educational sessions to explain things to patients.
Okay, nice. So you said that patients don't like taking their medications. Could you give me a reason why?
Yes. So we had a lot of reasons patients will give why they would not use their medications. Some of the common things that we will hear is, I don't feel sick, so why should I be taking the medication? So I actually had one patient who stood out in my mind because, he looked fine. He was very young, like in his late 20s, and he told me he had a massive heart attack. And I was really shocked about this because he didn't have high blood pressure, he didn't have diabetes. So I asked him, well, how you had a massive heart attack? So he explained to me that a number of years before the incident of the heart attack, he was told by a doctor that he had high cholesterol. And the doctor put him on medications for the high cholesterol. But he said to me he was not feeling sick. So he just did not use the medication. And some years after, he had this massive heart attack. So before the heart attack, he would have possibly just been on one tablet to control the cholesterol. And then when he didn't take the medication, the cholesterol caused this complication of him having this massive heart attack. Thank God he lived and he survived. However, now he has to be on 8 tablets a day to be able to continue living going forward. So, that was pretty frustrating for him. So if we could capture someone before they reach to the complication levels and explain to them how serious and how important it is for them to take their medication and control the condition once you could, and they can do that for themselves, it could really help prevent major complications from happening. So that was one of the answers we will get, that, Doc, I didn't feel sick, so I didn't see the need to take the medication. You want to hear some other reasons?
Please do, yes.
So they'll say, I don't want to get addicted to the tablets, so they didn't want to take the medications. But these medications are not necessarily addicting, but we need that the patient take the medication so that we could so that the condition will be controlled. So let's take the example of diabetes, all right? So when you take medication for diabetes, you don't get addicted to the medication, but you have to take the medication until we reach into a range, or we have to take the medication so that the diabetes will be controlled. Okay, so you have a speeding train, all right? And we don't want the train to run off track. So we want the medication, we want the patient to be compliant in what they need to do to control it and prevent this disasters from happening. So some of the things the patient should do is exercise at least 30 minutes a day for 5 days of the week, decrease the amount of high starch foods like roti, rice, bread, biscuits, sugary drinks, because these things, when we consume it and it gets into our stomach, it gets broken down and it converts to something we call glucose, or what somebody might say sugar, and it gets into the bloodstream. And when we have a high level of glucose or sugar in the bloodstream and it's circulating in the body, it causes a lot of damage to many different organs in the body.
Doc, could I say something? These are foods that people have regularly on a daily basis, essentials, we could say. So what are some foods that you would suggest that people with diabetes can probably take to, prevent this?
Like you rightly said, these are things that we usually have on a daily basis, multiple times of the day. So it may not be that we want to change what you're eating, but it may be that we want to change the amount, or we want to add in more vegetables, or decrease the, let's say we drink a lot of sugary drinks, soft drinks and juices, instead of buying it, we could make it at home, where we could control the amount of sugar that you add to it, And one of the things we will have our patients do is even see a dietitian who could sit with them, find out what they like to eat, and also advise them how to adjust their diet, that they can still have food that is satisfactory and nutritional at the same time. So it's not necessarily we want to cut out an entire type of food, but just that we want to adjust it in a way that is beneficial to the patient and whatever illness they have. So even if they have high blood pressure, we tend to want to decrease the amount of salt that is in their diet. I just want to mention there's one question that a patient asked me. He said, "Doctor, why should I be taking medication for the rest of my life if it doesn't cure me?"
Wow.
And
that's a really good question.
It is an excellent question. It is a really, really good question. Because, it's a valid question. Why should you be taking medications, let's say for diabetes, for the rest of your life if it doesn't cure you? And the answer is simply, again, because we want to control and prevent the complications that could come if we don't manage the illness. So actually, diabetes, when it is newly diagnosed within the first 4 years, there is a high chance that it could be reversed. All right, but in the event that it is not reversed, at least minimum, we must control it. So if a patient says, well, this is not going to cure me, so I don't want to take this medication, then it's like we just have this runaway train, and it's just a matter of time when something very bad is going to happen. So this is why, even though you might feel that you're not going to get cured and you may need to be on this medication possibly for life, that is still important to take the medications, because if we could prevent a stroke 5 years from now, we want to do that. If we could prevent a heart attack, this is what we want to do. So preventing complications so that the patient could continue to live a good quality of life.
Okay, nice. So what would these medications do in terms of preventing the strain from being run away?
All right. so it's not just medication, right? It's lifestyle change, using the medications, yes.
So it's a combination of different things.
Correct. And exercising and so on, right? So how it works. So let me just quickly explain, right? Let's use diabetes as the example. So when we have this high concentration of glucose or sugar circulating in our bloodstream, and it is in the blood, okay? It goes to different organs and it damages these organs, okay? So let's say it passing through the blood vessels where the blood flowing, right? So it mixed in with the blood and it's flowing through the blood vessels. And over time now, because it's in a high concentration, it's causing damage to the blood vessels. And the blood vessels to the eyes are very small. So when you have damage or you have some bleeding, your body by nature you will have a clot might form and it will start to heal the area. And over a period of time, you can have these clots forming over and over. And this is how you can have blockage of arteries. And if you're having a blockage of an artery, it will prevent the blood from flowing to the eye. And this is how patients can become blind from diabetes. Okay? Or if it is, let's say, the artery gets damaged and the blood bleeds out. So it's not flowing as it's supposed to, it's actually bleeding out. Okay? If that happens by the heart, so we have our heart and we have arteries to supply the heart muscles, right? So let's say someone has a damage to the artery to the heart and the blood, instead of going to the heart muscles, is bleeding outwards. This is what we call a heart attack. And similarly, when it happens in the brain, same concept, same arteries flowing anywhere in your body. So if it happens to an artery in the brain and the blood bleeds out of the artery and it doesn't go to the parts of the brain it's supposed to, or there's a clot form and it blocks the passage of the blood, this is what we call a stroke. So the areas of the brain that the blood is supposed to flow and bring nutrients and oxygen doesn't receive that and it dies. And this is what we call a stroke. So a simple thing of controlling the diabetes or the high blood pressure or the high cholesterol could prevent these major complications.
Okay. So is it possible for diabetes to be passed down from relative to relative?
That's a very, very good question. So genetics does play a role. So we find people, you would notice if the parents have diabetes, the children might have diabetes. So it could be genetics, yes, absolutely. But it could also be the same lifestyle, that everyone eating the same type of food, everyone living the same culture, everyone living the same type of lifestyle, you understand? So we don't just sit back and say, well, somebody's mother had diabetes, their father had diabetes, so automatically, let's just give up. This person doomed to have diabetes. That is not actually so. It's more like a lifestyle condition. So if we mitigate or we change the lifestyle condition before reaching that stage, you could prevent yourself from getting diabetes.
Okay, great. So is it possible for children, young adults, to get diabetes as well?
Absolutely, yes. So in our culture in Trinidad and Tobago, we have our delicious doubles, our fried foods.
Yes.
We have, and then with a lot of people working, it's just convenient and easy to either purchase fast foods or to make it at home as well.
Yes.
Even though it may not be the healthiest options, it's basically like we just kind of like surviving. Sometimes the mom also working in the home, the dad working in the home, and it's just to be able to move on, right? And have the children have something to eat, so that they could do homework. And it's just a busy lifestyle a lot of people live. So they may not have time to prepare proper meals and so on. So yes, actually children, just as adults could become diabetic, we do have children in Trinidad and Tobago who are diabetic. So at this point in time, I want to mention there are actually different types of diabetes, and I want to clarify. Is that okay?
Yes.
Yeah?
Yes, please.
So we have type 1 diabetes. So type 1 diabetes is when a patient from childhood, their body is not producing enough insulin, or no insulin at all, to control the sugar that is flowing in the body. So automatically, this patient from young age have to be on insulin for the rest of their life. So this is something that they were born with, all right? Then we have type 2 diabetes. What we're more addressing now is a condition that is based more on our lifestyle practices that, that we could tend to control and have a better, even sometimes prevent it from happening. Type 1 diabetes, they can't really prevent it, but type 2, we could prevent it. Right? But both of them, regardless which type a patient have, we want to make sure that they use their medication and control it. There's also something called pre-diabetes. Would you like me to mention about pre-diabetes?
Yes.
So pre-diabetes is when a patient gets tested and the sugar level is, or the glucose level in the blood, when you stick the finger to get tested, is higher than normal, but not high enough to be diagnosed with diabetes. So it's just higher than normal, but just under to be diagnosed as a diabetic. So we call that pre-diabetes. If we have a patient who is pre-diabetic range, we definitely aim to reverse it. We want this patient's number to go back into normal range as quickly as possible, and then we will continue to monitor this patient to ensure that they stay at this level.
Okay, just out of curiosity, what reading would give you someone who's pre-diabetic?
Okay, so like for instance, we have a test called a HbA1c that will tell us for the last 3 months what is your sugar control. So someone who is like about 5.8, that is entering into the pre-diabetic range. So it's just, we have like ranges and figures, so it's just a range that they fall into.
Okay. So Doc, I have a relative who is diabetic, and I asked her yesterday, so what are your fears about diabetes? What concerns do you have? And she actually told me that she's scared of being amputated, any part of her body being amputated, mostly in her feet. And I think that's a big concern for a lot of people as well, because being, without a foot, it's hard to get around, it's hard to do things. So could you tell us how could we prevent a limb being amputated?
Right, that is a fantastic question. So first of all, let's just talk about how it can happen. So when someone is a diabetic and it is uncontrolled for a period of time, it damages the nerves. Okay, so the nerves in the feet as well get damaged. So someone who is not diabetic and have all sensations and feelings in the foot, if you put on a shoe and there's a small little stone in the shoe, you will feel it. And you will know to take out the shoe, knock out the stone and put back on the shoe. But someone who is diabetic and do not have all the sensations in the feet may not feel if the foot is impacted with a small stone or a foreign body or a needle or something. And they will keep walking on this, and what will happen, the stone, we give an example of a stone, will keep burrowing into the flesh because they keep putting pressure over and over on it, and they're not feeling anything, so it will burrow into the flesh, deeply into the flesh. And they may not even notice it for a period of time. And what will happen? Anytime the skin breaks, then there's a very high chance that infection will set in. Okay? So this stone gets burrowed or into the foot, and over a period of time it gets infected, and they probably not even feel any pain from the infection. All right, and a relative or someone at home might notice, what are these spots on the ground? What are these bloody, reddish looking spots on the ground? When you follow it, you might find the patient, and then they'll realize, oh, something is wrong, let's look under the foot. And then they might come across that they actually have an infection. So this is how it could happen, right? And by that time, sometimes the infection could be really bad and it reached the bone, and then you may need to have amputation to prevent the infection spreading quickly to a larger area of the limb. So the question today she asks is, how could we prevent it? That's a wonderful question. So just like how every night we will brush our teeth, probably use the washroom before you go to bed, then you sit on a chair or on the bed and you take a mirror and watch below your foot. Watch between the toes, watch right around both feet to make sure there is no foreign bodies, to make sure there's no cracks, there's no bleeding. So inspecting the foot every night could prevent us, because if you pick up anything early on, it could be treated and stopped from progressing. All right, and this is what we want to do. So nightly inspections or daily inspections would be really a preventative measure.
Okay, great. So could you tell me why preventative medicine is life-changing?
Right. So preventative medicine is basically where we want to detect illness before it happens, or even if someone already have a medical condition, we want to prevent it from getting worse or leading to complications. So using the example of diabetes again, so some of the complications of diabetes are heart attack. So I just want to talk briefly about it, or heart issues, right? So, or heart disease. So let's say we have a patient who comes in with heart failure, and because of heart failure, they have fluid back into the lungs. So this patient might come in hospital gasping, gasping for breath. And when you put the stethoscope on the chest, you're hearing fluid straight up all throughout the chest. Okay, so now what we will do in emergency or in hospital is that we will aim to try to clear the chest of this fluid, and as soon as possible, let them go back home to their family. But the condition already started. So sometimes it's just a matter of time. By the next week, they come back in, gasping for breath, and it could be a vicious cycle. So it puts a strain on the patient herself, and could be a little difficult on the relatives too as well, because now you have to keep going regularly to hospital to take care of this problem. Now, if it is we control diabetes as soon as we could and keep it controlled, then we could prevent this exacerbation or this complication. So the main thing is that we want to prevent complications that could be caused by having these conditions. So another example is, let's say, a stroke, all right? If a patient gets a stroke because they have diabetes, high blood pressure, high cholesterol, all of these conditions, any one of them actually, and they have a stroke, and sometimes we have very, very young patients having strokes. Thank God if they survive, but now they could remain with debilitating problems that they can't move a whole portion or a whole side of their body. So then it's difficult to drive. It's difficult to work. It's difficult to take care of your family. It's difficult to take care of yourself, And then, it's really, really difficult quality of life that someone could lead when it is they encounter these complications. So when we control it and we prevent it from reaching the complicated stages, then the patient will have a better quality of life by remaining an independent person, by being able to take care of themselves, have their jobs, and just lead a more enjoyable life.
Yeah. So it's never too late to make a difference.
Absolutely not. So even if we reach a stage of someone already having, let's say, heart failure, all right, and I'm just using that as an example, then still you want to use the medications to control it and prevent you from keep having fluid overload in the lungs and ending up in hospital so often, And to be quite honest, I realize that some of the times the patient don't understand why they need to take the medication, which medicine to take, when to take it, how to take it, or sometimes the medication may finish and they didn't refill it because, they don't understand how important it is, because they start to feel a little better, so they feel, okay, I'm good now, so I don't need any more. And by us explaining and taking time out to explain to the patient and answer all of their questions to help them to remain compliant with the medication, they could continue to live a better quality of life than always getting into acute distress, from different episodes.
Doc, to my knowledge, a lot of these medications tend to make people feel awful. Could you tell me why?
Right. So yes, that is correct. So I will answer this question when we come back from a break. All right. And
Yes.
again, thank you, listeners. We'll be back shortly to continue this segment.
Yes.
Assalamu alaikum.
For the everyday lowest prices on all grocery items, trust Low Cost Supermarket for the widest variety of quality products at low prices. Freshly picked fruits and vegetables, healthy products for your well-being, high quality meat cuts, and a warm and friendly service. Low Cost Supermarket, Sun and Main Road, Cunupia.
I know I'm waiting for something to happen to me.
Chic Leisure Limited, making life easier. Our renowned great tasting vermicelli comes pre-cut in regular and parched, packaged to make preparation simple. Attention all doubles vendors and roti makers, try our high quality pre-sifted bromate free all-purpose and whole wheat flour, low price and conveniently packaged. For wholesale and retail prices, contact Chic Leisure Limited, Warrenville, Cunupia. Chic Leisure Limited, quality you can trust.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Doctor in the House for IBN's 20th anniversary. I am Dr. Nadia Braffett-Swamad, and today I have with me Reya Budu, who is my assistant, and we will continue our segment on preventative medicine using the example of diabetes. Welcome back, Reya.
Thank you, Doc. So the question that I have for you right now is, people complain all the time that their medications make them feel ill. They have a lot of side effects, negative side effects when taking these medications. What advice do you have for these people who experience this?
So, that is a very, very good question. So, sometimes when someone now starts using a medication, it could take a couple of days for their bodies to adjust to this new medication. So they might have some side effects of nausea, sometimes might have some abdominal pain, some soft stools, or, even if, let's say, a patient have high blood pressure and they start using high blood pressure medications, they might feel lightheaded at times. All right. So first of all, we will advise the patients to wait a couple days, see if the side effects is getting easier and less, because it's a new medication that is being introduced into the system. However, if the patient find that they're unable to tolerate it, it's difficult for them, then you go back to your doctor or your healthcare provider and you explain to the doctor or the healthcare provider what is happening, how the side effects are affecting you, and the medication can easily be switched. There are many, many different types of medications. You have many different companies producing the medication. So sometimes a medication from one company that is produced by another company, sometimes the same medication might work better on a patient because the amount of different ways they would have purified the product so it have a less side effect profile, and that might work better for a patient. Okay, so definitely go back to your doctor. Do not stop using the medication and say, well, I tried, it doesn't feel good for me, so I'm not using this medication anymore. And I just want to mention, now that is different. Side effects is absolutely separate and different to allergic reactions. So if a patient starts using a medication and then they start experiencing itchiness, hives or slight swelling on the skin, feeling the lips swelling or a discomfort in the throat, the tongue start to swell, all of these, this is allergic reaction, this is life-threatening, and this is something you want to seek immediate medical assistance for. So we separate allergic reactions to side effects.
Okay, great. So what are some benefits of people taking their medication?
Oh, that's a really, really good question. So some of the benefits, if someone take their medications as they are supposed to and control, let's say, again, we're talking about diabetes. Let's say someone has a number, the HbA1c number, which will tell us for the past 3 months what was their sugar control. So let's say someone's number is 12. You start off at a 12. That is very high because normal is like less than 5. Okay? So we just given an example here. All right, so let's say, normal is like less than 5.8, and this patient is at 12. So we want this number to get down into a controlled range. So when this patient at 12 start using the medication, exercising 5 times a day for 30 minutes, watching their diet, decreasing the amount of sugary foods or starchy foods that they're eating, and they start to make that effort, the number actually does start coming down. So from 12, sometime next 3 months you check them, they will be at a 10. And then 3 months again, they could be at a 8. And if you notice, we keep trending downwards. All right, so one of the benefits of actually using the medication as you're supposed to and making the effort that you're advised to is that you could actually control the condition. And some people actually go on to reverse it possibly as well. All right, but even if it is not reversed and it is at least controlled. Now, when it is controlled, then you have less side effects happening, less damage to the body. So then you have fewer hospital visits. You don't need to visit the hospital that often, okay? Because, sometimes we go to the hospital and we know the system in the hospital, we know the healthcare workers doing the best that they could, the system is a bit strained. And sometimes you have to wait in the emergency department for a long period of time. Even though you're waiting, you're still being seen, you're still being attended to, which is good. But it could be frustrating for someone. Yes. You wait a long period of time to be able to get a bed. So if it is, we control the diabetes and we prevent that visit in the first place. The patient happier. And when they go to hospital, a lot of times your relatives have to go too as well. So it's a whole strain on the patient and the relative. So if you control the diabetes or you control the condition, use the medications as they're supposed to, then you go to the hospital less. All right? Then you'll have a better quality of life. Right? You just imagine somebody who's really out of control with diabetes and you're feeling tired and exhausted all the time. And you become controlled. You find that you have more energy, you're feeling more able and capable. Sometimes you might experience a bit of brain fog or confusion because your sugar is so out of control, So you tend to function better. You tend to enjoy life better. You tend to be able to do your job better. You tend to be able to participate in family activities better. When you go out to have fun or you want to go on a hike or you want to go to the beach, you enjoy that better than feeling a little dizzy and just unwell. Yeah. Okay? Another thing is that you find like your quality of life just remain at a better level. You're able to drive vehicles because sometimes when it is someone is diabetic, let's just give an example, and God forbid they have an amputation, it really changes their entire life. They may not be able to drive anymore. They may not be able to do the job that they do anymore. You understand? They may not be able to be as mobile as they was before. So, and then it comes the part of this sense of depression and sadness because of what your life become. All right. So if we keep the patient in the best health possible, they feel happy about themselves. All right. And they enjoy life a bit more. And then you don't want to be, nobody wants to be a burden. You feel like you are a burden to your family. So we make this effort to use our medication, watch what we eat, do this 30 minutes exercise 5 times a week, and try to control it so that you just feel better about yourself. And once you better, then you feel like you don't need to be so much of a strain for others as well. I mean, I'm not talking in a bad way to anyone who's already in a difficult situation. Wherever you are, we're just gonna try to figure out what best we could do from here on out going forward. All right, so if you're already in this situation, we're still not going to just give up. All right, we're just going to see however best we can improve your situation, help you control the illness so that it doesn't get any worse. And regardless where you are, to still improve your quality of life as best as we could.
Okay, great. So, Doc, someone who has an amputation and is bedridden, would you say that they should still take their medications?
Very good question. So let's say a patient already had an amputation and they are bedridden, or they're very ill at this point in time, because it is a big change that someone have to go through if they have an amputation, right? So the thought might occur, well, this amputation already happened, where's the sense? I give up because the patient wasn't able to control the diabetes, they end up with an amputation, so it already happened, so that's it. And the thing is, I understand that this patient is going to go through a really tough time emotionally, psychologically. The whole is like a big shake-up for this person. It's something really, really, really difficult. Even if someone lose eyesight or end up in kidney failure or end up in heart disease, these are major, major things, and someone may feel to give up at this point in time. Where's the sense taking all these medications? Where's the sense continuing? And the sense is, we do not want another amputation. We do not want that the diabetes remain uncontrolled and then the other limb get infected. Okay, so we want to prevent further complications going forward. Yes, something very bad happened, and we're really sorry about that, but still, yes, you will have a time of grief and sorrow, but looking forward, let's say, for instance, we all understand that all of us at some point in time going to return to our Creator. All of us, nobody lives forever, we understand that. But whatever amount of years we have, we would like to have a good quality of life. All of the people, all of the patients want to have a good quality of life until that time. So this is why it's still important, even if the complications happen, to still continue, try your best, continue to use your medications. If you have relatives who are assisting you and taking care of you, let them go to your appointments with you so that they may understand, because they are not in the situation you are in, so they may understand the medications better. They would understand what the doctor is saying, so feel free, carry them with you. All right, so that they can help take care of you going forward better as well.
Okay, nice. Doc, let me ask you this, right? You ever feel like buffing your patients? Like when they don't take their medication and stuff like that?
I have to admit it is frustrating at times, but no, I don't judge, or I try not to buff my patients or judge them, because everyone's situation is different.
Yes.
Situations at home, situations with life, situations with your job, is really, really different for everybody. Not everybody have support. Not everybody, a simple thing as to go to the clinic appointment, you need passage, you need to have taxi fare, or you need to have someone to carry you to the doctor,
Yeah.
So I never try to buff my patients, or, they are not doctors. A lot of things they wouldn't understand,
Yeah.
So if it is you decide you cannot afford something, and you didn't really make it a priority, you didn't try to figure out another way to try to get through with it, and just remember we also have the healthcare services, the public healthcare services. We have CDAP, so doctors, when it is they give you a prescription on CDAP, you get these medications for free, whatever is available, So don't give up and, just say, well, okay, that's okay because I didn't get it this month. Try, see how what you could do to make that effort to get it. So, no, I don't buff my patients. I guess any healthcare worker will feel frustrated at times, but we also have to understand the situation of the patients could be different, and sometimes it's maybe that they just don't understand. We tell them so much information in a short space of time, and it is a lot to process.
Yes.
It is a lot to process, So no, I don't book my patients.
Okay. So, we've been talking about preventative medication and these things. Could you tell us what are some symptoms of diabetes?
That's a really, really good question. So some of the symptoms of diabetes, a person may find that they're feeling thirsty often, or that they have to urinate frequently, very often. They're going to the washroom very often, or they're just feeling tired a lot. They might have like a little lightheadedness, sometimes a little brain fog or confusion, or they can't think straight. And believe it or not, they might have like cuts or sores that just not healing or taking very, very long to heal. And also, patients may not experience any symptoms at all.
Really?
No symptoms at all. Yes.
So someone who doesn't experience symptoms, how would they know?
Right. So this is where it is very important for people to know their numbers. Know your numbers. What is your blood pressure? Is it within normal range, or is it elevated? Do you have high blood pressure? Then another number you want to know, what is your blood sugar reading or your glucose reading? Are you within normal range, pre-diabetic range, or are you diabetic? You also want to know what are your cholesterol numbers. Are you normal, or do you have high cholesterol? Okay, so this is why it's important to go to the doctor. If you have health fairs, feel free to attend. They often do these checks as well. All right, so let's just say, for instance, a doctor, or you went to a health fair and they told you your blood pressure is a little bit high. Are we going to not do anything about it? No, we have to do something. All right, so let's say they tell you that you have pre-diabetes. All right, you're not diabetic yet, but your numbers are elevated. So you're not going to just do nothing about that. We want to reverse that. We want to treat that. So now one of the things you need to get a glucose monitor so that you can check your sugar at home. Or if your blood pressure was elevated, you want to get a blood pressure monitor. So then the question is, but doc, I may not have the money to buy that. So then I would tell my patients, all your relatives who want to buy a gift for your birthday, for Eid, Mother's Day, Father's Day, you tell them, I need a blood pressure machine, so I'll be happy to get that as a birthday present. All right, so we just figure out ways, and when it is you monitor it and you write it down, the next time you go to a doctor's appointment, carry this reading with you so that the doctor could go through the reading and be able to prescribe medication if needed or advise you going forward.
Okay, great. So what can you tell people who use alternative medication?
Right. So I have had patients who would come and tell me, Doc, I stopped using my diabetes medication and I use this medication I saw advertising on television, and they say, well, this medication helps with diabetes or helps with high blood pressure. And what I need to explain to patients, okay, first of all, they would say, I don't like to take too much medications. Okay. So then they would explain to me, and this, I guess, makes sense in a certain way, right? So because you don't like to take too much medications, you stop the diabetes one that the doctor specifically put you on to use one that you see or the neighbor tell you going to work really good for you. All right? But the thing is, the one that the doctor put you on is specific for you. So the medications that is advised that say will help with high blood pressure or help with diabetes or help with cholesterol, that could be like a vitamin or a general thing. But when your doctor specifically diagnose you and tell you, look, your number is 12 and you're supposed to be less than 6, all right, and put you on medication, you should not switch that medication, okay, because this is something that is specific for you. And we need your numbers to go down. So let's say your number is 12. You switch out your medication. You start to use something that you think someone advised you, who is probably not a doctor. Again, we're not bashing anybody. I'm just explaining the situation here. And this person may not even know what is your medical condition, and they can't advise you properly, right? So your number is 12. You switch out your medication. You start using another medication or a supplement that you think will help with your condition. So from 12 now, you go to 13, you go to 14, you go to 15, and you get your condition get even worse. You know, so you might say, but that medication was causing me to have a nausea or upset feeling, so I didn't like it. So I just switched to this one that the neighbor or your friend or cousin told you to do. Like, and you're not having any side effects, so you're feeling better, so you think that it's working better. Right? And that is not actually true, because you want something that is individual for you as a person, right? And we want your condition to be controlled. So if you have to choose one that somebody tell you versus one that the doctor tell you for you to use the one that the doctor tell you to use, right? If for some reason it is too expensive or you're having some side effects, go back to the doctor and tell the doctor that we have a wide range of treatments and medications that you know we could switch to as well.
So different medications react different on different people?
Yes, actually that is a good question as well. So let's just take the example of something commonly used, right? Let's say a tablet that is often used for headache. Most people might find they fine with this tablet, but then you might have some people when you take this tablet for headache or for pain that they have an allergic reaction, or every time they take this particular tablet it makes them get a belly pain or make them nauseous or have some some sort of side effect. So yes, but somebody else might take the same exact tablet and have absolutely no problem with it. So we don't really know up front exactly who will have what side effect, and sometimes the percentage of people having a side effect for a medication might be very, very low. So let's say we have a medication and only 10% of people may experience nausea based on the research on the product, okay? 90% not experiencing nausea, not experiencing these side effects is still a good number, because you might quite well fall into the 90% category, but your friend might fall into the 10% who actually have these side effects. You understand? So yes, so medication may affect different people differently. And again, the example of high blood pressure. Let's say we have a patient who always have a very, very high blood pressure, all right? And we start them on some medication. So from having a pressure is very high, and suddenly the medication bring down the pressure, they might start to feel a little bit lightheaded at first, as they're now starting to adjust to the medication. But the same medication you give somebody whose pressure, who also have high blood pressure, probably not as high as him, and he may not have any symptoms, So we really don't know until the patient actually start using the medication and report back to us how the medication is affecting them.
Okay, great. So can we dive a little deeper into what is insulin?
Right. Very nice question. So insulin is naturally produced in the body. And what it does, it helps control the amount of glucose, or what people will refer to as sugar, that is flowing in the bloodstream, right? So when it is we eat food, it's broken down in the stomach, and then the nutritious parts of it gets absorbed and it flows into the bloodstream. So this is how we have glucose or sugar flowing in the bloodstream. So insulin is produced in the pancreas, and what the insulin does, pancreas is just another organ in the body, right? So anyway, so don't get confused with the words. All right, so I'm just trying to not use too much medical jargon here.
Yes.
All right. So this insulin, what it does, it helps control the amount of sugar that is flowing in the bloodstream or glucose in the bloodstream. All right. So when someone has type 1 diabetes, it means that their body is not producing enough insulin or is producing no insulin at all. So that patient have to be on insulin, all right, to be able to, for their sugar to be controlled. All right, this tends to happen from someone who's younger going forward. However, type 2 diabetes is that insulin in the body, so the blood sugar is not being controlled as well. They may not actually need insulin, so sometimes medications and tablets will work. However, it may come a point in time where they actually need to administer insulin. So this tends to be for people who are really have a very, very high number of, you know, how badly uncontrolled they are, right? Or how high their numbers are. So we may need to now advise this patient to go on insulin. The thing is, you may not need to be on insulin for the rest of your life. Not everyone have to be on insulin for the rest of their life, because sometimes the insulin, when you start it, it brings them down, bring down their numbers, and as the numbers start getting more and more control, we adjust the medications accordingly. So I just want to talk a bit about insulin. So insulin is when the one that the patient have to administer or use on themselves, right? Is that we will bring them into the office, and even if a patient already on insulin, sometimes they may not fully understand the dosages, how much to pull up, how much to use, and if they happen to use too much, then they could end up in the emergency department because the sugar dropped too much. All right, so in office, what we would tend to do is teach the patient how to use the insulin, you know. So we will demonstrate it to the patient, and we will also give the patient the needle, let them pull up a liquid from a glass vial, make sure they know the dosages, make sure they understand. So it's not just teaching, we want them to demonstrate it back to us to really understand, because sometimes you ask someone, you understand, and you say, yeah. You know, and this is time when they would say yes because they don't want to keep back, or they don't want to waste time, you know, or they might find, you know, it might be too silly asking the same question again. So we really try our best to make sure the patient understand, or the patient relative.
Yeah. So Doc, I have one more question for you. Is it possible for someone who was diagnosed with diabetes to still enjoy life?
Absolutely. Absolutely. It is very possible, and that is a goal as well. We want this patient to have the best quality of life possible, and by doing the things that you need to do, which is exercise 30 minutes a day for 5 times a week, use your medications as you should, and probably even see a dietitian who can help you understand meals and how you're supposed to eat, decrease the amount of sugary drinks and high starch foods. You know, this is where the dietitian will come in with giving specific instructions and guidelines, and yes, just basically doing what you need to do. Yes, it could be a struggle at times. Yes, you will fall off the wagon at times because you might get stressed with exams or work or life, you know, but we just have to keep picking up ourselves, keep continuing on, and doing the best that we can.
Yeah, great.
Right? So we are now approaching the end of our program, and we thank all of you for being with us for the program. We thank Almighty God for giving us this opportunity. We hope that this program was a help and of some information for some of our listeners and of some benefits. Jazakallah, may Allah reward all of you, and thank you for having us on Doctors in the House.
Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh.